Hi everyone, my name is Shane Lamba, and today I'll be presenting to you my informational interview with a public health professional. I had the fortunate opportunity to interview Dr. Chuck McKetney. He is the current Director of Community Assessment and Planning and Evaluation, or CAPE, at the Alameda County Public Health Department here in Oakland, California. A little bit about his education and past positions. He started public health by getting an MPH in community health education from Cornell University, and later found that he was quite interested in epidemiology and focused on social epidemiology for his doctorate from UC Berkeley's School of Public Health. And what really started his interest in public health was his first position actually as a school teacher after his undergraduate career. He became a teacher and he realized how many different issues and problems and inequities there were even within his classroom, and he really wanted to focus on how he could bridge the gap between those inequities, and he further did that by studying for his MPH and getting his PhD. Right after his PhD, he found himself working as a postdoctoral fellow at the CDC, where he conducted a little bit of social equity research and learned tremendously about program planning when it comes to community health. And right before his current position as director of CAPE, he was actually a director of a community health program in Contra Costa County in California. And he's worked for 20 years in public health, and he hopes to keep on striving forward as new and innovative strategies arise every year. A little bit about the work site of Alameda County Public Health Department. The mission of the Public Health Department is basically to work in partnership with the community and ensure optimal health and well-being of all people through this dynamic and interactive process that will uphold health throughout the future generations. More specifically, the division that he works in, or CAPE, provides this information and focuses on evaluation, program planning, and really bridging the gap between the root causes of health inequities. And this really stems from his interest as well, and it's fitting as he focused a lot of his research and his learnings on social determinants of health. Some primary responsibilities that Dr. McKetney has on his day-to-day have obviously shifted due to the pandemic, but as of now, he heads the COVID-19 data surveillance and reporting system for the county, with the focus and a lens of social justice and inequality, meaning what can we do after we collect the data. He also oversees the data that epidemiologists and his analysts work with and pushes them to think about a social determinants of health mindset when looking at the data and creating suggestions and recommendations for what to do next. He also collaborates with interagency stakeholders and performs needs-based assessments that help create effective and efficacious programs. To the right of the text, you'll see the 10 essential public health services, and I've starred the ones that pretty much match up or coincide with what Dr. McKetney's work does. And as you can see, there's quite a few that have been starred, and you can follow up with those on the next slide as well. He continues to also use a results-based accountability frame of mind, which basically helps him when it comes to creating these programs. He asks his stakeholders 3 types of questions in layman's terms, like how much will it cost, how well are you going to do this, and is anyone really better off after this program is going to be implemented? Where's the research to back that? And he also uses data and reporting techniques, and as a director, he's mentioned that as you go up in the ladder of your career and become at higher level, you end up having to do a lot of higher level thinking or macro level thinking. So he's always thinking about how do all the programs that we have at CAPE and in the Alameda County Public Health, how will they affect the community, and are they even effective enough anymore, and do they need to be assessed for another innovative take or another innovative strategy on it. And to the right again, you'll see those key strategies, those key essential services are starred as well, that match with the primary responsibilities. Some key takeaways from this presentation and also from my interview from him was pretty much communication is key when working in public health. As many people will be from diverse backgrounds, you really need to be clear and concise. He also mentioned having a strong analytical background and having really strong program planning skills, because public health policies and public health knowledge really are going to be translated into program planning at the end of the day. And he said knowing that can also help you advance in your career. And he said to me at the very end is showing empathy and understanding the community through their lens. We really can only understand the problems the community is going through until we really focus and show empathy towards the specific people in that community. I would just like to thank Dr. McKechnie for his time, and I would also like to thank you for listening to my presentation, and hope you learned a little bit about what a position at the director level in public health can offer and the skills potentially needed to perform well in that.